More than 1,000 Illinois children need some extra TLC, help eating or even breathing. They're what the state considers medically complex and technology dependent. Illinois is federally required to provide these kids and their families resources. Our Lauren Victory is always investigating and finds the state is routinely falling short.
Do you want to play peekaboo?
Sarah loves to play. Her bedroom's filled with small things that bring her joy and big pieces of equipment that keep her stable.
She can't walk, she can't talk, she can't sit independently.
Amy Weston is Sarah's mom. Her 7-year-old needs help breathing. Cords monitor her heart rate.
This is her feeding pump.
And these are just some of Sarah's medical supplies, all necessary after a traumatic brain injury as a baby before the Westons adopted her.
She needs 24/7 supervision. I always say it's like having a newborn, but with super high stakes.
The rest of the family does their best to help with Sarah.
We have to fill her water for her vent.
But it's Amy who takes over most of these daily tasks. AW is burned out.
It's a privilege and honor to take care of Sarah, and I wouldn't trade it for the world, but even the state says it's not a one-man job.
The state, meaning the Illinois Department of Healthcare and Family Services, which says Sarah is qualified for in-home shift nursing. She's approved to receive 112 hours per week, but only gets 44 hours covered. That's less than 40%, a gap
Good girl.
this Johnsburg mom is forced to fill.
It's not sustainable. Definitely, your own self-care suffers, your mental health suffers, your sleep suffers, your whole family suffers.
Someone who also knows that feeling is the Elk Grove Village father who spends every night on this twin bed to monitor his daughter's breathing. The state routinely has shorted the Cook County family by more than 20%, so Dad is the de facto night nurse.
Who's that baby?
The Rizos from Montgomery are also exhausted.
Without somebody monitoring him 24/7, it could be drastic.
CBS 2 first told you about their situation in June. Despite being cleared by doctors, 1-year-old Nicholas Rizzo was forced to stay in the hospital because the state couldn't find him enough home care nurses.
2 months almost that he's been able to go home.
4 months after that interview, Nicholas busted out. Look how happy he is at his house. Mom and Dad, on the other hand, say it's been a little rough because Nicholas is getting nowhere near his state allowance of 126 hours of home care a week. No night nurse means one of the parents stays awake until 2:30 a.m. Then the alarm goes off to swap. This CBS 2 records request reveals the state approved a total of $306 million from September 2022 to September 2023 of home care coverage, but only $115 million, less than 40%, was used for a variety of reasons. The Westons and other families tell us they've grown accustomed to their needs not being met.
How often are you asking for additional nursing help?
At the beginning, a lot. You kind of get to the point where well, I'm just not going to get help, so this just is my life.
A lack of home care nursing is not a new problem. A group of parents raising medically complex children sued the state over this issue in 2015. Tomorrow night at 10, we look at a new state solution and ask if it's really going to help exhausted families like the ones you just met.